in today's session, we will be first describing the Ascii, and then we will discuss its online counterparts. What is happening at present that we all practical examinations, and it has got certain limitations. It is insufficiently standardized, and in bedsides examinations with patients of varying degree of cooperativeness, and also with the increasing number of students, and also with the certain diseases not reaching the medical colleges, they are going into more into private sector. There is increase in the living standard of people. People are becoming, patients are becoming less accepting. So the standardization of practical examination is decreasing, and there is insufficient objectivity and intrusion of certain factors which are irrelevant to the examination. There can be less time. There could be certain factors like the patients becoming uncooperative after a certain period of time. So practical examination is becoming more and more difficult. There is a limited feasibility for large groups. As the number of students increases 150 to 250, the feasibility for large groups, they say that there is a death of the long case, and there is a huge difficulty in arranging examiners to observe candidate skills and sitting there all the time for such a large number of students. At the end, if the practical is of 4 days, the examiner is exhausted just by sitting there for if there is a long case or even short cases, if they are subjective as they are happening at some places. So, and also in the preclinical and paraclinical subjects, the patients, they have the students, they are subjected to certain procedures which the examiner is not able to see for each and every student. There is lack of objectivity, lack of validity. If one student has made a slide properly, but we cannot examine him per se because the examiner may be lacking in time, or the microscope may not be working, or there are a lot of factors which affect assessment. So the answer to these problems is objective structured clinical examination. So what is the word objective structured? I mean, what we do, we take the usual examination and convert it into certain parts. I mean, the student comes to approaches the patient. Does he make him relaxed? Does he take his pulse? Does he take his BP properly? Does he check his temperature? Does he take certain histories? And after making it structured, we test each and every part of the clinical examination rather than the entire process in one go, and we check whether each and every component of the examination is done properly, like taking history, auscultation, interpretation of ECG, and there is a definite procedure behind each and every process, and then it is examined, and then you go and give the result. And basically there is a rubric available with the examiner, and who objectively checks these these questions or certain examines each and every part. So what is there? The basic principle is that the entire clinical examination is converted into multiple skills, and each skill is given is tested in the form of a specific question to be answered in 4 to 5 minutes, and which is a station, which is converted into a station, and for each question or station a checklist is prepared in advance, which is available with the examiner. And this checklist is for example, we are staining a slide. How the student takes the slide, how he makes the smear, how he what is the time period he keeps the certain amount of the Leishman stain. So, and each and every step is discussed and its relevance also discussed. So by dividing each and every portion of the examination, we are able to test the student. And how do we conduct it? We have got special places where multiple stations are created, and students spend specified time on each station, about 4 to 5 minutes, and on the signal of a bell, he or she moves to the next. And in the process, he is tested. So there are two types of stations. There is a procedure station that is taking the history of the patient, and also where the examiner is viewing him, how he handles the patients. And then the next is the question station, where an MCQ or certain question is there, which the student answers in the lab report. So we have procedure station, question station, alternating with each other. So in the procedure station, we have the history taking exam or examination the patient. The examiner is present, who uses a checklist to record the performance of the student as they pass through the stations. Another type of question in which there is just an X-ray. There is no need of an examiner. Student just sees the X-ray and answers his question regarding the his findings and moves to the next station. And he, based on his answer, he may be given some extra information on his how he. This is for example, this is the patient who has fever, cough, etc., and this is the his X-ray. So he has to deal with a particular scenario, and the examiner has got certain checklist with him. So these are the two on your screen. You can see the student's checklist and the examiner's checklist. So in this checklist, the examiner sees whether the student has taken this patient's age, occupation, pain, different types of histories, whether he is able to, whether he has specifically asked for that particular history or not. And this is mainly the examiner's checklist, and based on this, this rubric, the patient, the examiner gives the student certain marks. Then also the attitude of the patient, whether the teacher asks specific questions, and before asking questions, did he make the patient relax? Did he attempt to establish a rapport? These are very, very experiential feelings. They cannot be taught easily, but it is through your body language, through asking certain, making the patient relaxed, welcome Mr. So and so, and maybe asking something about his family, we are able to relax the patient. And also the way the history is taken, and there is a definite structured process by which the student asks the history, and along with by which we are able to see whether he has actually followed the procedure, and then he is able to give the mark. So this is the general Oscii, how we do it in the real in the pre-COVID era, in those colleges where Oscii has been going on. So these are certain questions of history taking. Which of the following statements are true about the patient whose history you have taken? So we ask a MCQ question, which of the histories has which are relevant. So, and the examiner's checklist is there, whether he in a case of neurological examination, did he inspect the legs, did he check the tone, did he check for clonus, ankle, knee, etc., etc. And for the general proficiency, whether he took the did he carry out the procedure properly, the sequence of procedures, and also his attitude towards the patient. Did he treat the patient respectfully? Was the patient comfortable in answering his questions? So all these things are actually checked and marks given accordingly. Now we will take a question station where there is a physical examination. So which of the following statements are true about the patient you have just examined? This teacher, the various, whether he inspects the muscle, the tone of, I mean, there are a number of questions regarding that patient, and there are certain possibilities. So there is an MCQ, and he is asked about these and other components, the inspection, the interpretation of a patient's chart, lab record, temperature record, BP, ECG, biochemical report, hematological report, and various components of patient, educating the patient, the interpersonal skills with the patient, the various instruments, specimens, all these can be used as Oscii stations. And knowing the skill of we will take a sequentially of a patient. We will, for example, we will first examine the abdomen. Then there is a answer station 1, some questions about the abdomen, examine chest, some questions about chest, take the history, some questions about history, and some more questions about history, and then CT scan, answering questions on CT scan, ECG, answering questions on ECG, the various instruments and questions, and there is a lab data, cardiovascular examination, questions on say various regarding CVS, neurological examination, so some slide spot is there, all these can be there. So there are special rooms where such Oscii stations are created. They could be on the side of the ward, there could be special rooms. So, but this is the structure by which an Oscii station is created, station room is created. In pre and paraclinical examination, there we have got objectives where we don't have clinical examination, but we have practical examination. So there the term used is Oscii, but the basic principle is same. So here we use procedure stations and question stations, and they can be used as supplement to different methods of evaluation. And for example, in first prof, we student checks spirometry. So does he check the spirometer for leakage? Mouthpiece is whether inserted or not? Nose clipped properly? Does he take normal breath before determining vital capacity? The various procedures which are needed before a spirometer is actually used, and every step is used in this procedure. I will suggest a book by the Checklist Manifesto by Dr. Atul Gawande. The Checklist Manifesto, it is a must read for anybody who is dealing with medical education. There he has told you about the importance of checklists in medical science, how important checklists have become. Once you read it, I mean, you will see that by simply making the using checklists, the efficiency of most of the medical procedures increases. So there is a question station in which 3 multiple choice on vital capacity are there. And again, we take the example of demonstration on movements on an X-ray, and also a question and answer, then identifying the part, the vital capacity, neurological examination, the Newbar's chamber, the urine protein, the questions on urine protein, lab data. We can just keep a histogram or just the kind of TLC, DLC of a patient. We can use slides as a spotter, and then a certain lab data. We can keep a gross specimens, and then ask questions on those gross specimens. We can ask him to draw from the vial the dosage of certain diseases and the evaluation, the prescription. All these can be created in Oscii station, and Osceis are not spotters. There's a definite procedure that at each stage the student is examined separately. So the various objectives which can be there for the questions asked by determining what vital capacity, using a Newbar chamber for doing RBC count, recording blood pressure for auscultatory method, preparing blood smear. So we will take just a small part which of the entire procedure and examine the student. This way large amounts of curriculum can be tested, and some more possibilities are testing urine sample for proteinuria, testing glucose using a standard method, and then in the question stating interpreting the results, preparing hanging drop, interpretation of a slide, I mean, or a microorganism. So you can just give final result of a urine examination and just ask the student to write what he sees instead of actually doing it. And also we can use a graphical record of the experiment. Some more examples like identification of drug formulation, writing a prescription, or there could be a calculation of dose of the drug, or filling of syringe according to a dose, setting up IV drip for a given rate of infusion. So giving instructions to the patient for the use of a particular drug. These are certain skill sets which should be there, and the students need to be trained. So through this checklist method, every skill gets highlighted, examined, assessed, certified. So
now we are going towards an implementation part, that how we are going to implement it. Now let's go to how we can organize the Oscii. So we can divide into these 4 parts, that advanced planning is required, organization just a day before examination, on the day of examination and after the examination. And then we will take how to do in COVID, because what we are discussing right now, the question may come into your mind that what to do in COVID. So that also we are going to discuss. And today we have James, who is going to take you to the, we can say, an high fidelity online Osce. So what advanced planning is required? So ideally before 6 months we should start planning, because we know that many ifs and buts will come in between. Or for formative exam, at least we should start thinking before 8 weeks. So what to do in advanced planning? First, we need to decide the examiner who is going to take an exam, because we need to address them, we need to train them. Because what is happened that we are very reluctant to go outside our box or outside our comfort zone. So we need to decide the examiner. Then we need to decide what to examine as per our objective, that what we want. For example, we are taking Osce and we want to take examination of, we can say, palpation of chest of cardiovascular system. Then our objective will be different for a first year, and objective will be different for a third year. So we need to, as per the objective, we have to plan that what we are going to examine. Then we need to give the weightage to the different component. Looking in, being in a physiology, I will give that this much part will be given to experimental physiology, this much station will be from hematology, this much station will be from clinical physiology. And then we have to decide regarding minimum standard or pass, regarding norm criteria or criterion method. So what we want to follow, that also we have to decide. And then we need to brief our examiner and concerned staff. In case of formative and summative, we can ask our examiner when we are appointing that we are going to take examiner this way, and please take care of it, that plan your journey accordingly, because it's our habit that we just come before 1 hour or 2 hours to take an exam and then we'll start the exam. So briefing of examiner and concerned staff is very important. Next is preparing venue for the staff, venue and staff. Why? Because in routine case we are taking viva, we can take in small room, or we can take into a chamber. But when we are discussing regarding Osce, we need to have a venue like this, where we can arrange the station. Okay, you can see here there are total 20 stations are there, but sometimes what happened that we don't have a few stations, so at that place we can have a blank space. So whatever is remaining in a previous station, student can write. So we need to find out a venue where we can have a room like this. Sometime if you see, you should have a partition between this 1 and 2. And if you don't have partitions, you can have a green curtain and make a partitions. So this is an important things which we have to take care. Okay. So this is the way we should to develop our room. Next is selection and briefing of patients. So the patients can be either standardized patient or simulated patients. Routinely, what we do is we ask our any peons or any other class 4 to become a patient, and we need to brief them also that this is the way students are going to examine you. Now one problem will come when you are using standardized patient in case of Osce, and that we need to explain the patient, because all the 25 person or all the 25 student or a candidate who are appearing in that particular time, that are going to do the same thing. For example, if I am doing examination of abdomen, all 25 students will do the examination of abdomen. So it may be sometime cumbersome to the patient. So we have to brief the patient, and if required, we can change the subject or we can change the participant after few students. So for that, we need to brief the standardized patient. Then we need to prepare the document, finalizing the checklist, and it should be peer reviewed, because sometimes there is a variation in the view and it may affect the marking. That's why we must have a peer reviewed checklist. Same way as discussed, we need to instruct the examiner regarding the brochure session and question session, and if they are not aware, we can just explain them, taking them before our exam starts to the room and explain them. And we need to confirm the duration of each session. How? For example, I am giving in hematology, identify the cell under the microscope. So it should be finished within a 5 minutes or whatever time I want to give. So it need to be confirmed by performing actual practical or a station once before our exam starts. Otherwise, all the students will not able to finish, and we need to do some remedial sessions or remedial mechanism after the session is over. Now, on the day before examination, need to check everything, arrangement, all the instruments, reagent, microscope is working is not. See, whatever things we are keeping, we have to keep 2 microscopes, because once the student is going, uh, immediately second student will come. So we need to keep a second microscope, third microscope. So instruments should be double in number, so that if anything is done wrong by a previous student, it should not affect the timing of afterward students. And we need to do the final documentation and we need to give it to the examiner. Now on the day of examination, coordinator must arrive 1 hour prior to the time, final checking of arrangement, briefing of the student, and as it will start simultaneously, all examiners should have arrived and are at their correct station, and then we can start, because at every particular time, 5 minutes, 10 minutes, we are going to rotate the student, and so everybody should be there at the venue at the same time. And this sometimes is cumbersome to the examiner, but we have to make them understand. At our institute, we are doing in summative and formative assessment since last 5 years. And one more thing, for which examiner or we are little reluctant is, we will not able to come out of that room before the exam will over, because it is going on continuously throughout the timing, because students are going to in rotation. Okay, so this is on the day of examination. And after the examination, if it is formative assessment, give the feedback to the student by showing the checklist or questions, score, and you can also explain them score wise. So this is after the examination. Now, I would like to have your views. You can write in the chat box that what limitation you think are there of Ascii or Osce. You can write in the chat box. You can also write your queries in the chat box. We will take session once Dr. James finish his session. So please let us know what are the limitations of Ascii. Yes, can we have a few response? There is one thing, psychomotor assessment is not possible, sir. Psycho for Ascii is for psychomotor assessment. Yes, more manpower is required, more staff require. Student may try to copy. For that, I would like to explain that if you have a 50 station in physiology or your subject, and if student have mug up all the 50 station, what more we want? Difficult to arrange subject in physiology, yes. Okay, actually we have overcome these limitations of a subject, we are able to get it, and now there are paid subjects are also available per student. You can pay them, and you will get the person. Yes, time management is there. More examiner is required. For that, I would like to tell that if you have a less examiner, as there is no question answer, it is a simple observation. You can use your resident. In fact, you can use your technicians, you can use your tutors, and if required, you can also use your interns for assessment, because it is checklist based assessment. Okay, great. So we need to find out the solution for our problems, and solutions are there. We need to think out of the box, and we will get the solutions. So all you have already covered, all the limitations you have already covered. So where we can use it, stage out the student in case of formative and summative assessment. Then for the purpose, based on the purpose, also we can use Ascii and Osce. If you see the pleb exam, which is used in UK, like USMLE in USA, they are using Ascii. Okay. So now we have discussed so many things. We have limitations here also. But now what about the corona? What about the post-COVID? We have to go online. Now we already have some limitations in offline Osce. Now how to conduct it online? See, everything has some limitation, but in whatever limitation we can work, I have tried to share few solutions for online Osce, and let's see Osce or OSPI. Let's see it how we can go for it. Okay. So first, we all are using this Zoom, WebEx, GoToWebinar, or Webinar Jam, and different things are available. You can see that there are breakout room in each and every this platform. So what this we have already implemented. These are the photographs of pediatric OSCE examination. That what we did, I will just explain you step. Also that what we did is we have created a breakout room, and students are already allotted to breakout room. And we have same in OSCE and OSPI. We have a teacher at each station. We have a teacher at each breakout room. Now at each breakout room, see here the limitation is you can't see much psychomotor skill, but you can have a cognitive skill. You can take off a judgmental skill. You can take a history taking. You can check counseling, because the student or the other person, for example, here the second person has become a dummy patient, and so we have asked student to take history of that dummy patient, and few of the station we have asked them to counsel that dummy patient. So that much you can do using this breakout room. So what to do? What are the steps here also? Let's go through the steps. Decide the time and date of objective of examination. Then decide the station, that what are the procedure session or response session you want to do. Then we have to decide the platform, whatever is available, Zoom, Google Meet, whatever is there with us, we can use that. Then we have to prepare a station based on about two thing, that is a platform and type of station. Then debrief all the student, or we can say brief all the student about the event. You can also give a trial, as this is new for us, is the same way it is new for the student also. So we need to do the trial with the faculty, with the trial with the student. Then we have to assign the faculty and student for the respective breakout room, and then we have to capture the student interaction using a respective platform. Same way as we are using a checklist, the checklist will be used by the faculty, and we can grade the student. We can download the recording and a report of the student, and in fact the faculty can be at the distant place, not need to be at one place, and all can send their grading using a Google Drive or a Google Sheet, and all can be combined together, and it can be finally graded, and then can be displayed for the student. So this is the one way we can take the Osce. Now second thing what we did, we have used the Google form. See, one thing I admit that here the limitation is you are not going to check actually student is performing or not. But here you can check up to the level that okay, student is knowing this much, that what step will come after what. That much we can do. Let me show you Google form how we did it, and this we have used to teach also. But these are the steps. Go through this. You do it multiple times. Okay, for example, this is an HB estimation, and here there are the step number 1, 2, 3, 4, 5, 6, 7, 8, 9, and we have taken it up to 10. It is up to 10. Okay, so now here if you see, here are the step 1, 2, 3, 4, 5, 6. They are not in a linear fashion, but they are efficiently put. So now what student has to do, has to think that sucks the blood up to 20 ml. So which step it will come? Does it come on second number, on third number? So by this you will come to know that okay, student know this much. So this we are using for training also. So like this, student has to mark the number, that this is one number, this is a fourth, like that. 6 times just putting randomly, 7, 8, like that, 9, and then I will press the next and submit. So this is the way student will come to know that what score he has scored, only 2 out of 10. So he has to do this multiple time until and unless he get 10 out of 10, and so this we can use for a training also. and we have used this for our assessment also. We can give the name virtual Osce or Osce. Now, second platform which we have created, our college has created this, that is mcourse.co.in. This is a platform. Actually, we are going to discuss this in detail in the next week. So we will share the link for joining the same. So here also what we did, we have created virtual Osce. Let me take you to the student view. So student will sign in using his ID password. Here is the Osce or Ospe, we can say. He has to select the subject. So you can see that find out the blood group and estimate the bleeding time of your own capillary. So student will click here. He will be directed to the different timing and mark and all the things are there. And then I will start my Ospe or Osce. So this has been already done. So it is saying that, so I have already passed this during trial. So it is not allowing me to retake it. So this is my blood group. And now you can see that step 1, here we have written step 1. So what step I will do? So I can just click here, interpret the result. I am just putting randomly like this. So this is also, we can say, a virtual Osce. Putting in place of text, you can put an image also like this. You can do. So it is saying that I have already selected question number, option number 5. Would you like to take it? No. So I can close it. So like this I can use, and finally I can submit. So once I can finish like this. Same way, let me show you one example of image. So like this, you can ask them that which step will come first and which will come second. So I can just select step 1 is this, done, like this, step 2, and I can finish it, and student can perform it multiple times. So this we can say a very low fidelity virtual Osce. Okay. So we have gone through Google Phone and MCourse, and now we are going to know regarding EMS by Mr. James McCrea. He is the regional sales manager. And
so yes, thank you very much for the introduction, gentlemen. Thank you and good afternoon, everyone. My name is James. I am the regional sales manager covering the international territory for EMS. I'm just going to give you a quick background and overview of our company, and then jump straight into our virtual Osce platform that will tie nicely into the subject matter that Dr. Shah and Dr. Bedi have covered today. So my company is an American US-based company. We're based just outside of Philadelphia in Pennsylvania on the East Coast of the US. We've been in business since 1994, and we focus and specialize on healthcare simulation training environments. And we have done since our company was created by the husband and wife team. So we only work with medical centers, colleges of medicine, colleges of nursing, and various other healthcare professions where their learners are training and practicing to become a specialist. You can see on the next screen, it lists various first to market for medical simulation, and we pride ourselves on being an innovator and using the latest and greatest technologies to enable our customers to fulfill their training goals and needs. I'm not going to read off each line on the screen, but EMS has been a pioneer in the medical simulation training arena, and we continue to create new solutions as the market demands the need for those solutions. On the screen next, you're seeing some of the associations and acknowledgements that we've received from different institutions, and also the certifications that we've received from our equipment suppliers and the equipment that we work with. So we work with the Society for Simulation in Healthcare in the middle. We, up until this year, we did exhibit extensively at different conferences and organizational events around the world. But this year, due to the COVID-19 pandemic, all in-person conferences and events have been cancelled. We're optimistic for next year, but if ever any of your team members or viewers on the webinar today attend INACSL, SSIH, or the National League for Nursing, or SIMGHOST events, we do partner with these organizations, so please stop by our booth. We would be happy to speak with you. What our platform does, our brand name is Simulation IQ, and we have various descriptors for different capabilities and different solutions. We have some hardware-based solutions which records and captures the simulation training activity in an Osce environment, in a sim environment where you're using a high-fidelity mannequin. And we also have various online platforms, and in particular, in response to the COVID-19 pandemic outbreak, we've created a virtual Osce telemedicine style capability to allow institutions to have all participants be in remote locations to complete your Osce and Osce examinations. The core areas of our company and our solutions are to capture, organize, and analyze all of your healthcare simulation and training activities within your institution, whether it be virtual, whether it be in person, or whether it be actually at a medical facility where there are real patients. And that's our brand name, Simulation IQ. The company is Education Management Solutions, and what we try to offer is smarter simulations to create better outcomes, which is what we're here to help facilitate that outcome. So what I'm going to focus on for the next couple of minutes here is our virtual Osce capability, which, as I mentioned, is something that we created earlier this year as a offshoot of one of our learner management platforms, which is our Simulation IQ Enterprise platform, which is a completely online platform. You go to our virtual Osce site. We create a login for our customers. The only requirement is that the participants, so faculty, the learner, if you're using an actor or a standardized patient to play the role of a patient, they need to have one, an internet connection, and two, a camera, either a camera on the laptop or built into a desktop, or an external web camera that can be plugged in. They're the only requirements that we have for the platform. Everything else is completely online. And it's designed to be a simple to use feature. Everything is recorded. It has a telemedicine web conference capability built into the platform, and the utilization of the activity is all tracked and managed by our software platform. So I'm going to click through and show you various slides of our virtual Osce capability. It's called virtual Osce, but it can also be applied to the OSCE, the practical examination as well. It doesn't just have to be for clinical. That is the name that we have given this solution, but it is flexible in terms of how it can be used. So the next screen that you're looking at here shows the dashboard configuration of our virtual Osce platform. It is built on the learner management platform of Simulation IQ Enterprise, and that is a robust simulation management software platform for managing everything. So we can create cases, create scenarios, you can arrange sessions and courses, we can record and capture all of the video, you're allowed to perform evaluations, and then you can track all kinds of scores, reporting metrics based on the data that's been gathered. But in these unprecedented times in 2020, not everything is going to be in person, And similar to India, institutions around the world and governments around the world have actually locked down campuses and shut down operations. So those institutions were still looking for ways to complete their core syllabus requirements, and doing things remotely was something that our customers came back to us and asked us to create a platform to see how they could achieve that. So we have created this directly in response to COVID-19, and we have hundreds of customers utilizing it now. So all of the content that you would have for your learners for the Oscii that they would be taking, or the OSP that they would be taking, would be built into our framework, so that the faculty member, the learner, or the standardized patient would just have to log into our platform, and all of your details would be built in from our education and training team working with a designated person at your institution. So instead of actually being a room that they would go into, as Dr. Shah and Dr. Bedi mentioned, the typical Oscii setup is where you have different stations. Instead of physically going into that station, you would just click on a link and go into a room, and you would see them virtually. There's different video access permissions that you're able to set from an organizational point of view. Do you want the learner to have access to the video afterwards? Do you want the standardized patient to access the video, support staff, and also evaluator access as well? This is set on the administration side. You're also able to roll out a blueprint of operations for a particular day and time, where you can see the number of time slot sessions for those activities. So you're able to roll out the Osciis to occur at the same time in the different virtual rooms, and then have a sequence of Osciis that they will follow onto, or OSPs that they will go on to do, similar to how they would do it if they're walking around a large room with the different breakout stations. I mentioned a link would be sent where you would be able to access the web platform and log in. We would work with your IT department to use Active Directory, so you would use your same institution's email address and password to log in, so that you wouldn't have to create a new email and an additional password. You would have your institution's graphics here, and everyone would go to a web page that we would create and assign for you. So you can see I've logged in now as a participant, and right in the middle of the dashboard has the to-do list, where it shows the telemedicine encounter and also the post-encounter afterwards for the evaluation. To begin, you just need to click on the Start button, and it will begin the encounter. It will open the next box that says that the video conferencing capability is about to begin, and you click on the Start Video Conference to begin, and then you click on the next screen and you will see the other participant for the activity, and then you can begin your questions just as if you're walking into a patient room, meeting a patient for the first time. The standardized patient, or the actor playing the role of the patient, will be able to notify the participant when their time is up, or they have 1 minute remaining, and then they can close the encounter when that's finished. All of the videos are recorded into our platform for the faculty member evaluator to evaluate afterwards. If they want to rewind any of the footage, they can do that. So all of your content would be built into our platform. All of your scheduling would be created and built in and managed by EMS. Again, to finish, at the end, you would click the Finish Video Conference, and then it would return you back to the dashboard. And then you can see the actual encounter has gone away from the to-do list, and the Evaluate for the post encounter is next to complete. You're able to monitor a session for all of the activities that are in progress. So if you do have any external examiners that would want to watch the activities and log in to view them without the participants being aware, but if you're taking high stakes examinations and you're being assessed by an external examiner, we have the capability to do that. Similarly, if a standardized patient or a student is not there or is ill or absent, you can change the student in terms of the rotation for your sessions and the courses that you have assigned. So you click on the individual and then that can be changed out. You also have at a quick view shot, you can see what's actually been completed, what's in progress, and what's currently pending in a color-coded chart. So it's quickly and easily for you to see, right, this has still got to occur, what's been completed. On the evaluation side, when the faculty subject matter expert is evaluating and performing their assessment, they have the ability to add their bookmarks, to replay the video recording, and then make their judgment. And as simple as that interface looks, it's designed to be quick and easy to use. As I said, all of the heavy lifting with your content, your curriculum, your participants, your learners, your faculty, your standardized patients, actors, and then scheduling everything together and coordinating it is done by our education and training team, working closely with a designated person from your institution, but it enables your institution to complete and continue your course for your learner assessments while everyone is working remotely. As Dr. Shah and Dr. Bedi mentioned a few minutes ago, there are some limitations, and the most obvious is the physical examination component of the Osce. But we have customers that have devised unique ways to perform the physical examination when everyone is not next to each other. So an effective way that our customers have described to us the physical examination component working is to verbally speak the commands of what physical action or activity they would take based on the patient's responses to their questions. So if it is take their pulse, speak and verbalize that physical action that they would take. If it is, check their heartbeat or whatever the action may be, they would speak that, and then the standardized patient would be trained to respond in a certain way if the learner asks them a particular question. But you have the creativity there and flexibility to work with how you want to interpret the physical examination component.